Hi everyone. In today's clip, I will talk a little bit about Tinea Versicolor. Just a reminder that anything I post here is not meant to diagnose or cure anything, and it's for informational use only. For any health-related matters, please consult your healthcare provider. So Tinea Versicolor is also called sun fungus in some regions, and it is a superficial fungal yeast condition caused by overgrowth of Malassezia, which is a yeast naturally living on human skin. It is common and usually harmless or not typically dangerous, and it is often recurrent. The main issue is usually skin discoloration, cosmetic distress, and recurrence. So what happens in the skin is that the yeast shifts from a normal resident into overgrowth form under favorable conditions like heat, humidity, sweating, excess oils, immune shifts, and hormonal changes. The organism can interfere with melanocytes and pigment production, leading to pale patches, tan or brown patches, or even like pinkish patches. And the color depends partly on the skin tone itself and the inflammation. Common symptoms are appearance of uneven patches, fine powdery scale, and sometimes mild itching. And common locations are chest, back, shoulders, and neck and upper arms, actually. So clues are that this becomes more visible after tanning, and scaling becomes clearer when scratched lightly. And also there's no clear lines or borders around the discoloration. Diagnosis is usually done by clinical examination and scraping, where the microscope is going to show spaghetti and meatball patterns. Modern medical treatment include topical treatments, most common with selenium sulfide, usually around 1% to 2.5% lotion or shampoo applied to affected skin and left 5 to 10 minutes, then rinsed. This is going to be done daily for 1 week or few times weekly for several weeks. Oral prescription antifungals are also used for widespread cases, recurrent or resistant cases, and pigment normalization can take weeks, months, or sometimes a whole lot longer. This confuses many people into thinking that the treatment actually failed when the organism may actually already be suppressed. So recurrence prevention is super important because recurrence is common, and the doctors sometimes recommend periodic antifungal shampoo washes, especially during warm months. From the orthomolecular medicine perspective, healing usually centers around immune balance, skin ecology, inflammation control, microbiome, and mineral status. Nutrients that are suggested for this condition are zinc for skin health and immune regulation, usually between 15 to 30 milligrams of elemental zinc daily, and because excess zinc long-term may lower copper supplementation may also become required. Vitamin D3 and K2, because low vitamin D has been associated with various skin conditions, so they give 1,000 to 4,000 international unit daily of D3, and for every 1,000 international unit of D3, you would need 100 milligram K2. MK7 form is better of the D3 for better absorption. Higher dosing also ideally would be monitored and should be monitored. Then there's probiotics, which is super important for gut-skin access and immune modulation. There is selenium, often around 100 to 200 microgram daily, not too much selenium because it can become toxic. Omega-3 fatty acids for inflammatory balance. And from the traditional medicine perspective, this is looked at as imbalance of humors, heat, moisture, digestion, and organ function rather than microbes. So as I have mentioned in my previous clips, we have 4 humors in the body: blood, which is warm and moist; yellow bile, which is warm and dry; black bile, which is cold and dry; and phlegm, which is cold and moist. And these are also called temperaments. So conditions resembling fungal discoloration are often viewed as disturbances involving excess dampness, altered blood quality, weakened digestion, or imbalance of black bile or phlegm. So the approaches contain correcting digestion. Digestive weakness is thought to contribute to abnormal bodily residues reaching the skin. So we recommend lighter foods, avoiding excess sweets, and reducing overly moist, heavy foods. Also, drying excess moisture, since many skin eruptions are viewed as moist or damp disorders. So applications sometimes include vinegar preparations, sulfur-containing compounds, herbal cleaners, and aromatic herbs. Next, we have blood purification concept, which is emphasized through burdock-like and bitter herbs, liver supportive plants, and improved elimination. Next, we have sun plus herbal sensitizers. We usually carefully control sunlight exposure after herbal applications, remembering that excessive exposure comes with the risk of burns, actually. So modern medicine primarily focuses on direct fungal suppression versus traditional approach, which is focusing on changing and healing the terrain that allows occurrence or recurrence. Because the skin is less like a battlefield and more like weather patterns moving across the living terrain, basically. Hope this has been helpful. My clips are available on TikTok and YouTube. Like, share, and follow for more. Be the light.